Starting this month, Medicare will pay for weight loss drugs that normally cost $500 to over $1,000 a month for a flat $50. It's a brand new program and almost nobody's heard of it yet. But here's the part that trips people up. If you've been hoping this covers Ozempic, it doesn't. I'll explain exactly which drugs qualify and why. There's also a specific BMI and health condition checklist you need to meet. And one detail about it that almost nobody explains, that could still qualify you even if you've already lost weight. Today, what this program actually covers, who qualifies, and exactly how to ask your doctor about it. I'm Ray. Stick around to the end. There's a scam warning you need to hear, because this is exactly the kind of headline scammers copy. Quick note before we start. I'm not affiliated with Medicare, CMS, or any government agency, and I'm not a doctor. This is educational, not medical or financial advice. Always talk to your own doctor and verify at medicare.gov or by calling 1-800-MEDICARE before making any decision. Let's start with what this actually is. It's called the Medicare GLP-1 Bridge, a short-term CMS demonstration program, not a permanent benefit, running from July 1, 2026 through December 31, 2027. If you're enrolled in Medicare Part D and you qualify, you pay a flat $50 a month for certain GLP-1 weight loss drugs, instead of the $500 to over $1,000 a month people without this coverage typically pay out of pocket. Now, here's the mix-up almost everyone runs into. The drugs covered are Wegovy, both the injection and the tablet form, Zepbound, but only the KwikPen version, not the single-dose vials or pens, and a newer drug called Foundayo. Ozempic is not on this list. Same active ingredient family as Wegovy in some cases, but Ozempic is approved specifically for treating type 2 diabetes, a different indication. And this program is specifically for drugs approved for weight management. So if your doctor has you on Ozempic for diabetes, this particular $50 program doesn't apply to that prescription. It's a completely reasonable mix-up to make, because most of the news coverage over the past few years has just said Ozempic as a shorthand for this whole category of drugs. But for this specific program, the name on your prescription bottle matters. So who actually qualifies? Medicare uses a three-tier system based on BMI and a couple of specific health conditions. Tier 1, a BMI of 35 or higher. No additional diagnosis required. That number alone qualifies you. Tier 2, a BMI between 30 and 34.9, plus one of these conditions: heart failure, uncontrolled high blood pressure, or chronic kidney disease at stage 3A or higher. Tier 3, a BMI of 27 or higher, plus a diagnosis of prediabetes, a previous heart attack, a previous stroke, or symptomatic peripheral artery disease. In every tier, the drug has to be prescribed specifically to reduce excess weight and maintain that weight loss, combined with an ongoing plan for nutrition and physical activity. And you need to be 18 or older, which, if you're watching this channel, you obviously are. Now here's the detail almost nobody explains, and it could matter a lot to you if you've already been working on this. Medicare looks at your BMI from when you first started GLP-1 therapy, not your BMI today. So if you started this kind of medication back in 2024 with a BMI of 37, and today, because the medication worked, your BMI is down to 33, your doctor can attest that you met the Tier 1 threshold when you started, and you can still qualify for the $50 program now, even though your current numbers look different. So how do you actually get this? It's simple, but it goes through your doctor, not through a website or a phone hotline. Step 1. Talk to your doctor about whether one of these specific drugs makes sense for you and whether you meet one of those three tiers. Step 2. If it does, your doctor sends the prescription to your pharmacy. Step 3. Once the pharmacy confirms you're eligible, your doctor submits a prior authorization form to Medicare for approval. If you have questions about your eligibility or you want to check the status of that authorization, call 1-800-MEDICARE directly. That's the official number, and it's free. One more money detail, and if you watched last week's video on the changes to your Social Security check, this will sound familiar. That $50 a month copay does not count toward your Part D deductible, and it does not count toward the $2,100 out-of-pocket cap we talked about last time. It's a separate, flat fee outside that whole system. That's actually good news here, It means this $50 is predictable and capped on its own. It won't suddenly jump partway through the year the way some other drug costs can. Here's what to actually do. 1. At your next appointment, or by calling your doctor's office now, ask specifically whether you meet one of the 3 BMI and health condition tiers I just covered. 2. If your doctor already has you on a GLP-1 for weight management, ask directly whether it's one of the 3 covered drugs: Wegovy, Zepbound in the KwikPen form, or Foundayo. And if it's not, ask whether switching makes sense for you medically, not just financially. 3. If you started a GLP-1 medication in the past and your BMI has changed since then, mention that history to your doctor specifically. It could still qualify you under the original tier. And one warning, because this is exactly the kind of headline scammers copy. If anyone calls or emails you claiming to be from Medicare, offering to enroll you in this weight loss drug program for a fee, or asking for your Medicare number or bank information to process your $50 rate, hang up. This program only works through your own doctor and pharmacy. Medicare will never call you first to sign you up for anything, and there is no separate enrollment fee beyond the $50 monthly cost of the medication itself. Hit subscribe. I cover the Medicare and Social Security changes that actually affect your wallet every single week. Does this program apply to you or someone you know? Tell me in the comments. And if you know someone paying full price for one of these drugs right now, send them this video, because $50 versus $500 a month is worth a phone call to their doctor this week.